Welcome to another episode of the iRock podcast, right? Special edition of the Epilepsy Week. So you're probably asking yourself, yep, why? Why Epilepsy Week? I've just realized we still have a long way to go about understanding what is epilepsy. So, question one, what is epilepsy? In simple terms, epilepsy is a repetitive of seizure attacks, and one might be asking what's the difference between having a seizure and having fits. On Friday, on Friday, that's where I want to start. What is the difference between seizures and fits when they say someone is fitting? Is it the same thing? Is it different? I don't know, right? We'll find out together on Friday. So, here's what I want us to talk about today, right? Before, let me just do this. Welcome to the iRock podcast. This is the intellectual relations of consciousness. So it's day 3, and we are gonna talk about what causes epilepsy. The most common thing that many people would think of is, well, and it's obvious that in most cases that's what happens. So what usually happens is you get to inherit epilepsy, meaning it is through genetics that one gets to be diagnosed with epilepsy. And through that then you get to also have other people who did not inherit it. So we'll take an example of a person who had a car accident and they had a very, very terrible bump with their head. So meaning that there were some damages to your brain, and that can actually cause you to start having a seizure. Meaning when you were born, you were not born having seizures, but after having that accident, then you start to have seizures. So that means that they did realize that there was something wrong within that, meaning there was something wrong within the brain, meaning you had like a head injury. So sometimes it might not even be a car accident. Probably maybe you fell and you knocked by your head. And in other cases, it'll be because of sports. And in other movies, we've realized that there was a movie that was circulating and it mentioned epilepsy in sports, that when you are playing, and concussion as well. So head injuries might also lead into one having an epilepsy or seizures, right? Now let's move to this two. One, you might be having a brain infection, meaning there was a surgery that was done on your head and your brain had an infection. Or it might have developed, meaning there wasn't any medical procedures, like an medical operation that was done, but then you had like a brain infection. So that brain infection might lead into you having seizures. And remember that epilepsy is the repetition of seizures. So that might be the first thing. Now, the second thing on this case, it might also be your immune disorder, meaning your immune system is weak. Now, when it is weak, then you start to have seizures. When you have seizures and they start to be repeating themselves, that is epilepsy, and that's how you get diagnosed to say now you are epileptic. And then you have that also runs along with your metabolic disorders, meaning you have too much energy. I used to have a lecturer and he would say you have maningi energy. So you have maningi energy in your body, and now your body cannot cope with that energy. That can also lead into you having epilepsy. So as you can see that there is like a lot of different things that lead into one having a seizure. Now, the other thing we can also include in this, it's developmental disorders or birth disorders, meaning you did not inherit it, there wasn't any operations done on your head or on your brain, there's no infections, but there were complications during birth. Now, those complications during birth can lead into you having a seizure. Now, your first seizure will will be determined by the doctors. Most of like the parents, others they will have them right after labor, and other kids it might be before they reach the age of 5 years. And we're gonna talk about how do we treat that, the treatment as well. And then you might also have like some brain condition or brain vessel abnormalities, which now remember that when I started, I mentioned the transference of signals and in from your brain to the entire body. So when you have abnormal brain vessels, that also leads into you having a seizure because it is not able, like the brain is not able to transfer the energy or like the signals to the entire body, which then leads to you having a seizure. So now, moving on, how is epilepsy diagnosed? So the first thing is you'll have a seizure, right? You'll have a seizure. Depends on which community do you come from. Others, you will not go to the hospital. Others, you'll be rushed to a clinic. But now, I just want us to focus more on when you are being rushed to a clinic. Prior that, when your friend, colleague, partner, parent, or child is having seizures for the first time, it is very important that you check for the pulse if they are still breathing, check for their skin if their skin is pale, check for muscle jacks. You need to just be attentive into that. It might be scary though because it's happening for the first time and everyone doesn't understand what really is happening here, but you really need to stay calm and focus on what is happening. Now, why am I saying that? This is because there are a lot of things that might be like an epileptic seizure, whereas it's something else. So the doctors, they will do that. They'll ask you questions to say, was the skin pale? Did you notice any muscle jerkings? Did you notice any muscle stiffness? And talking about muscles, here's one muscle in your body that a lot of people they don't had like to talk about, which is your bladder. Now you might also lose control of that organ, which is your bladder. So now when you lose that, then that's when you actually pee yourself or wet your pants, and that is also another thing that you have to notify the doctor about when you're going there for consultation. Then two things after that might be done. The first thing is they might take you for your MRI scans, which is basically like looking for brain tumors in your brain. Yeah, brain tumors in your brain. So they're looking for brain tumors. And the second thing is known as EEG, which is your electroencephalography, which so basically what they are doing then, this is a test that they do to check the level of like electrical activity within your body to say like, is it normal or is it abnormal? Then that's when further steps can be taken about that. So what are these further actions that are being taken after that? Treatment. Your treatment will firstly depend on what type of seizures are you having. So there is no one type of medication for your seizures. So there are different types of those medications, and those come with different effects to your body. And yes, the latest, well, it has been happening and it hasn't been changed that much. When you are taking Epilim to prevent your seizures, then you cannot donate your blood. So yes, you can't donate because then the doctors need to always check the Epilim levels within your bloodstream. So if you donate blood, that means you are taking out the Epilim level. So it needs to be of a certain amount. There needs to be a certain amount of Epilim level in your body or in your blood. Then that's when the doctors can give you a go ahead to say, yep, you can continue, or no, you still are not cleared off to continue and donate blood. So now that's the first thing. And now you also, they will look at in terms of your age, because some of this medication they cannot really give them to kids, yet they can give them to adults. So your age really matters too. Other medical conditions you might have, they can also determine what type of treatment are you being given. And the side effects of the anti-seizure medication or anti-seizure drugs that you are being given, they'll look into the side effects to say, this is what they do to you in person. Because also the side effects, they are not for everyone. So some other people, they'll have a certain side effects, whilst other people have another side effect. And all of those, they also add up into what type of medication are you being given. Now the last part, which is the most unfortunate part, it is the cost of it. To some extent, other people they can afford, other people cannot afford. So for those who can afford, they'll go for a better treatment, and those who cannot afford, they won't have as better medication like those who can afford. So yes, also the cost of living does come into play when we're talking about the treatment for your epilepsy. So I'll just like it to end it there for today. Thank you again. It has been a week already. It has been 3 days and we are still talking about epilepsy. Thank you for sharing. Thank you for subscribing. Thank you for helping me in raising awareness about what is epilepsy, the triggers, the treatment, the everything about epilepsy. Thank you for being part of this journey in raising awareness about it. And remember, you might not be the one having epilepsy, but you might know someone. Might be a friend, your partner, girlfriend or boyfriend, might be your parent, might as well unfortunately be your kid. Epilepsy is real and epilepsy is deadly. So please share this video and spread awareness. Till we talk tomorrow, same time, same place. Cheers.